Strokes are the third leading cause of death in the United States and a leading cause of serious long-term disability. But cardiovascular researchers and doctors don't really understand why some people are twice as likely to suffer from strokes than others. Now they're looking to NASA and the University of Alabama at Birmingham for new insights. The university is home for the REGARDS project. REGARDS stands for Reasons for Geographic and Racial Differences in Stroke. The study, funded by the National Institute for Neurological Disorders and Strokes, recruited a cohort of over 30,000 people across the U.S. to help determine what's driving racial and geographic differences in stroke mortality rates. They performed health examinations including blood pressure measurements, EKGs, blood and urine samples, and administered a detailed health questionnaire looking at overall health status, places lived, dietary intake, social networks, and even access to care. While medical doctors can make connections between stroke and modifiable risk factors such as one's diet and lifestyle, researchers have decided to take a look at another external factor, surroundings in which one lives, defined as an urban, suburban, or rural environment.
They are interested in land surface temperature to the extent that it may affect hypertension and stroke incidence. We also give them data on air temperature and heat index.
Part of the reason why UAB is the perfect location for this study is its location in the stroke belt, a collection of southeastern states where stroke is most common.
Basically, individuals who reside in the stroke belt, the stroke mortality rate there is 1.5 times that the national average.
This is where NASA comes in. Atmospheric and Earth Sciences at the National Space Science and Technology Center in Huntsville, Alabama, home to the Marshall Space Flight Center, use remote sensing technology through space satellites to learn more about environmental changes on the Earth.
You can't really measure or use remote sensing to measure directly public health factors, such as cancers or asthma or things of that sort. So basically what we're doing is providing additional information the medical professions can actually use to incorporate that into their overall research data to provide extra information it had never really had before.
While the REGARDS project is looking to improve the lives of all Americans, it is focusing on African Americans because that group has a higher risk of stroke, hypertension, and cardiovascular disease.
If you're Caucasian and you reside in the southeastern United States, you have a 29% increased risk of having a stroke. When you compare that to African Americans, that increased risk of stroke rises to 59%. So we know that the problem is definitely there.
We and UAB are going to learn a lot about the relationship between environmental conditions and public health, with the ultimate goal of improving the health of African Americans in the Southeast and across the country.
This partnership between UAB and NASA also is creating a generation of researchers, learning how to use satellite imagery to further their studies. Dr. Sarah Parkak is the director of the Laboratory for Global Health Observation, the first remote sensing lab dedicated to medical and public health.
I think a number of students, before the NASA senior scientists came in, they weren't really thinking about remote sensing long term, and now some of my students are talking about doing summer internships at NASA and going to grad school just to study remote sensing.
While results of the REGARDS study are still forthcoming, this lab is planning on making strides in the West Nile virus and malaria by finding mosquito breeding grounds using remote sensing. Scientists appreciate making the leap from studying weather patterns to helping public health.
If we can understand what causes these geographic and racial disparities, and in general, really what different risk factors for stroke are, then we can implement interventions to help reduce the rate of stroke, and people everywhere can live longer, healthier lives.
Satellites have revolutionized weather forecasting, communications, and travel. So why not human health?